It was lymphoma. It was my husband.
It was breast cancer.
זו הייתה אימא שלי.
It was my dad. It was pancreatic cancer. And being able to make drugs, make treatment more accessible and affordable for other patients so they don't have to go through what my family went through is what ultimately drew me to TailorMed.
TailorMed is here because the health system is broken and is creating challenges because of so many complexities that we obviously won't get into. But at the end of the day, it leaves one really important part of this health system alone, and that's the patient. And we are here to serve patients.
One of our main challenges here at TailorMed is around our domain. We need to know a lot of things that usually people who work in high-tech don't need to be aware of. The way that medical data is stored in EMRs, in the pharmacy management systems, how they all interact together, how the data flows from the hospitals to the pharmacies, to the pharma companies, to the insurance companies. We need to aggregate all of those and use those logics in order to help the patients afford their medication.
The way that we're helping move mountains for patients is being able to provide tools and programs that patients can apply to that will ease the financial burden that they're experiencing. Along with that, ultimately just being there for our customers that are serving these patient populations and making sure that their voice is heard.
I think it's really a win-win-win situation because the patients win and the hospitals win and we win because we get to provide them this service.
It's fun to be here, not just for working, also for communicating and generally how to move mountains for patients.
When one injection for you costs $40,000 and that's a 1-month supply, that can really impact somebody if they don't have any assistance or if they're on Medicare. Everything that goes into making all of that care and that treatment more accessible and affordable, like that is the mountain that we're moving.
TailorMed has a perfect combination of a mission that we can all relate to and are very much engaged to, and people. The people are really what makes the difference here.
I've had the opportunity to work with a lot of software companies and healthcare companies over my career, and this is the first one where we're really doing something that directly impacts patients rather than just the bottom line of the revenue cycle of the hospital system.
The software we're building is definitely like helping get people access to care that wouldn't otherwise have it.
I absolutely feel like the work that we're doing is benefiting patients' lives financially, emotionally, furthering their impact to do anything within the community as well.
It is still the beginning of the story that TailorMed has to tell in the world. I think that we're seeing so many others, whether it's through their medication affordability challenges or just affordability of healthcare in general, that we have so much to do in our current network of providers and pharmacy, but more broadly in America and in the world.